I'm Dr. Marissa, and today I'm going to show you one simple nighttime mistake that many adults over 60 make every single night without knowing it may be affecting their breathing, their blood pressure, their brain, and even their morning energy. I'm talking about your sleeping position. Now listen carefully. If you wake up with morning headaches, if you wake up tired even after 7 or 8 hours, if your neck feels stiff, if your mouth is dry, if you snore, toss, turn, or feel pressure around your head when you wake up, this video is not random. This video may be exactly what your body has been trying to tell you. Because many people think sleep is only about how many hours you get, but after 60, sleep is also about how your body is positioned during those hours. Your head, your neck, your spine, your breathing, your blood flow, all of it matters. Stay with me until the end, because I'm going to show you the sleeping positions you may want to avoid. And then I'll show you 2 safer positions that may help your body recover better tonight. And before we begin, tell me in the comments, are you a back sleeper, side sleeper, or stomach sleeper? Your answer matters because one of these positions may be the reason you wake up feeling worse than when you went to bed. Now let's begin. The first sleeping mistake is sleeping on your stomach, and I want to be very clear. For many people, stomach sleeping feels comfortable. It feels safe. It feels familiar. Some people have slept this way for 20, 30, even 40 years, but after 60, this position can become a problem. Why? Because when you sleep on your stomach, your face cannot stay straight into the pillow. So what do? You turn your head to one side, and not just for 1 minute, not just for 10 minutes. You may keep your neck twisted for hours, night after night, year after year. Now think about what that means. Your neck is turned, your spine is not neutral, your chest may be pressed against the mattress, your breathing may become shallower, and in the morning you wake up with neck stiffness, shoulder tightness, or a strange heavy feeling in your head. Many people say, I just slept wrong. But if it happens again and again, it is not random. It is a pattern. This is where most people get it wrong. They blame age, they blame the pillow, they blame stress. But they never blame the position that kept their neck twisted for 7 hours. If you are over 60 and you sleep on your stomach, I want you to try this tonight. Do not force a sudden change if it feels impossible. Instead, place a pillow beside your chest or stomach so your body slowly learns to turn toward your side. The goal is not perfection tonight. The goal is progress, because your neck was not designed to stay twisted all night. And if you are a stomach sleeper, type stomach in the comments. I want to see how many people this applies to. Now, the second sleeping mistake is using too many pillows under your head. This one is very common. People do it for snoring. They do it for acid reflux. They do it because they feel like they breathe better. They do it because one pillow does not feel high enough anymore. So they stack 2 pillows, then 3, sometimes even 4. But here is the problem. When you stack pillows only under your head, your neck bends forward, your chin moves toward your chest, your spine loses its natural line, and your airway may become more crowded, not more open. That is the part many people miss. They think more pillows automatically means better breathing. But if those pillows push your head forward too much, your neck may be in a bad position all night. And how do you notice it? Morning headaches, neck pain, a heavy feeling behind the eyes, waking up tired, feeling like your brain did not fully rest.
Now stay with me here, because this next part is important.
Elevation can help some people, but the elevation should support the upper body, not just bend the neck. That means a wedge pillow or adjustable bed is usually better than stacking pillows under your head. Your head, neck, and upper chest should rise together in a smooth angle, not your head alone. So tonight, look at your pillow setup. Ask yourself, is my neck straight or is my chin being pushed down? If you are using 2 or more pillows, type the number in the comments. 1, 2, 3, or more. Because this habit is more common than people think. Now the third sleeping mistake is curling too tightly into the fetal position. This is the position where your knees come up high, your back rounds, your shoulders fold forward, and your chin tucks down. And I understand why people sleep this way. It feels warm, it feels protected, it feels natural. Especially if you are stressed, cold, or used to sleeping on your side. But after 60, sleeping too tightly curled can create a problem. Your chest has less room to expand. Your breathing can become more shallow. Your hips and knees stay bent for hours. Your neck may stay tucked forward. And when you wake up, your body feels locked. Your knees feel tight. Your back feels stiff. Your neck feels heavy. And again, you tell yourself, this is just old age. But what if it is not only age? What if your body was simply folded too tightly for too long? Here is the simple fix. You do not have to stop side sleeping. Side sleeping can actually be helpful for many people, especially those who snore or have breathing issues. But open the position. Put a pillow between your knees. Keep your knees slightly bent, not pulled all the way to your chest. Keep your chin away from your chest. Hug a pillow if that helps your shoulders stay open. You want a relaxed side position, not a tight ball. That small difference can change how your body feels in the morning. If you wake up stiff every morning, this may be the one you need to test tonight. Type stiff in the comments if morning stiffness is something you deal with. Now, mistake number 4 is sleeping flat on your back when you snore or struggle with breathing at night. Back sleeping is not bad for everyone. Some people do well on their back. But if you snore loudly, if someone has told you that you stop breathing during sleep, if you wake up gasping, if your mouth is dry every morning, if you wake up tired even after a full night, then flat back sleeping may not be your best position. Why? Because when you lie flat on your back, gravity can allow the tongue and soft tissues in the throat to relax backward. That can make the airway narrower. And when the airway narrows, breathing can become more difficult. This is why many sleep experts say side sleeping may help reduce snoring and sleep apnea symptoms in some people. Now listen carefully. I am not diagnosing you. But if you snore loudly, wake up choking or gasping, or feel sleepy during the day, please talk to your doctor about sleep apnea. Sleep apnea is not just annoying snoring. It can affect oxygen, blood pressure, energy, and heart health. And many adults have it without knowing. So what can you do tonight? If you are a back sleeper and you snore, try side sleeping. Use a pillow behind your back to stop yourself from rolling flat. Use a pillow between your knees to keep your spine comfortable. And if side sleeping hurts your shoulder, try a slight upper body elevation using a wedge pillow, not a pile of pillows under your head. A smooth incline. Now stay with me because I'm about to show you the 2 sleeping positions that may be better for many adults over 60. The first better position is side sleeping with support. For many adults, this is the most practical place to start. Lie on your side, place a pillow between your knees. Keep your knees slightly bent, keep your neck straight. Your pillow should fill the space between your head and shoulders so your neck is not dropping down or bending up. Your spine should feel like one long line, not twisted, not curled, not collapsed. If you feel pressure on your shoulder, hug a pillow in front of your chest. This keeps the upper body more open and may reduce that tight rounded position. Now, which side should you choose? For many people, the best side is the side that lets them breathe comfortably and wake up with the least pain. Some people prefer the left side because it may help with reflux. Some people with certain heart conditions may feel better on the right side. So do not force one side if your doctor has told you something different or if one side causes pain. The goal is simple. Breathe better. Keep the spine supported. Wake up less stiff. That is the win. Try it for 7 nights. Not 1 night. 7 nights. Because your body may resist a new sleep position at first. Now the second better position is back sleeping with gentle upper body elevation. This is for people who cannot sleep on their side because of shoulder pain, hip pain, arthritis, or long-term habit. Instead of lying completely flat, elevate the upper body slightly. A wedge pillow can help. An adjustable bed can help. The key is this. Your upper body should rise together. Head, neck, shoulders, and upper chest, not just your head. You can also place a small pillow under your knees to reduce pressure on the lower back. This can make the position feel more relaxed. For many people, this position may help reduce snoring, reflux, morning pressure, and back discomfort. But again, comfort matters. If you feel worse, stop and adjust. Your sleep position should help your body recover and not fight against it. Now let's bring this all together. Tonight, I want you to check 4 things before you sleep. Number 1, is your neck straight? Number 2, is your breathing easy? Number 3, is your spine supported? Number 4, are you waking up with headaches, stiffness, dry mouth, or tiredness? Because your morning symptoms are clues. They tell you what happened overnight. A headache may be a clue. A stiff neck may be a clue. Dry mouth may be a clue. Waking tired may be a clue. Poor balance in the morning may be a clue. These are not reasons to panic. They are reasons to pay attention. Before you change anything, remember this. If you have serious heart disease, severe sleep apnea, recent surgery, major neck problems, breathing issues, or unexplained morning symptoms, talk to your doctor before making big changes. And never ignore warning signs like chest pain, weakness on one side, trouble speaking, sudden severe headache, or shortness of breath. Those need urgent medical help. But for many people, small sleep changes can make a real difference. Less neck twisting, less pillow stacking, less tight curling, less flat back sleeping. If snoring is a problem, more support, better alignment, easier breathing. That is the goal. So tonight, choose one small change. If you sleep on your stomach, start turning slightly to your side. If you stack pillows, try supporting the upper body instead of bending the neck. If you curl tightly, open the hips and use a pillow between the knees. If you snore on your back, try side sleeping with support. One change tonight. That is all. Now I want you to comment one word. Which one are you? Type stomach, pillows, curled, or snore. And if this video helped you, subscribe, because in the next video, I'll show you the morning habit many adults over 60 do that may be making their blood pressure rise before breakfast. I'm Dr. Marissa. Take good care of yourself tonight. You came here thinking sleep was only about closing your eyes, but you are leaving knowing that your position may affect your breathing, your neck, your morning energy, and your recovery. You came here with a sleep habit. You're leaving with a map.